Well, good afternoon. I'm Graham Douglas. I'm founder and CEO of Arete Medical Technologies. Arete is working on precision and prevention in long-term lung disease like asthma and COPD by bringing the right data to the right use case at the right time. My background is I have a PhD from Cambridge in biomedical engineering and am asthmatic. I was formerly a quite high-level competitive swimmer, including captain of the university, which was really my motivation and inspiration for starting Arete. Chronic lung diseases like asthma are huge unsolved problems. They have globally about 200 billion in direct spend, and they're the third leading cause of death. These costs are huge across Europe, across the United States, and other countries. Much of these costs come from hospital stays and from increasingly biologic and niche targeted drugs for subtypes of asthma and COPD. And that's also what we're focusing on to start with, is sort of the high need, high acuity patients. So in respiratory health tech, there has yet to be a category defining winner like there has been in other health tech areas. And we think the reason for that is to date, there's been two silos of development. First of all, we've got high quality lung measurements that are confined mainly to specialist centers, and they're very expensive. And then secondly, we've got low cost, often user friendly, often very portable technologies, but aren't really powerful enough to actually make actionable changes in people's care. We will fit in the category where other health technologies have been really successful, which is combining the best of these two worlds. So there's yet to be a category defining winner for lung health. We will be the first to get product problem fit with the right technology and the right use case, and then we can follow successful commercial models for other conditions. So RespiCorder brings the three key measurements of lung inflammation and lung mechanics from the specialist use cases to GP surgeries and home monitoring. We've got 3 patents granted to combine these measurements together, and this lets us bring car-like economics to smartphone-like economics for having this equipment available. Today, these are 3 separate devices taking up most of the room in a hospital clinic. Spirometry measures lung function. Oscillometry measures the flow resistance and elasticity of the lungs. And Pheno is the best point of care measurement for lung inflammation. And we can add additional measurements to this in the future as they're proven clinically. We have a digital first design using Android as our only user interface, which then gives a good conduit for data to be sent to the cloud, shared appropriately with the health team, and processed over time. So we are Arete Medical. We are addressing a huge unmet need with a great product with granted patents. We are currently going through our initial design freeze and have been granted last week our ethics clearance for 2 clinical studies, one in Amsterdam, one in London. They'll be starting ideally by the end of this month, if not into February. Thank you very much, and would like to take any questions now.